Welcome back, Peyronie's healers. This video is of most importance. This is a list of what not to do before you start your natural healing journey. If you have started these practices, no worry. Just stop now and study my site and actionlove.com to learn the real long-term healing ways. I am not a doctor. This is not medical advice. Consult your licensed physician for medical advice. I am Robert, and I have healed my Peyronie's condition after studying the late Dr. Lynn's website, actionlove.com. Okay, let's get going with what not to do to heal your Peyronie's condition. Number 1, do not use any stretching device, traction device, in an attempt to heal, correct curvature, bend, or enlarge penis. Take it off immediately and throw it in the garbage. There is a website in which I will discuss in future videos that promotes it like it is the second coming of Christ. I can assure you that stretching your penis in any way will cause much more damage. There are hundreds of case studies on actionlove.com explaining how it is the #1 cause of scarring. I myself learned the hard way, and it delayed my healing time by years. I will do a full video on this subject. Number 2, do not use any jelqing, aka manual stretching techniques, or hanging weights to try to correct curvature or enlarge penis. Stop at once and never do it again. This will cause the same damage as a stretching device as in rule number 1. Number 3, cancel any future appointments that will involve injecting anything into your penis. Any injection into penis will permanently destroy a few blood balloons in your penile chambers that are responsible for filling up when erect in that area. The surrounding tissue will be destroyed also. Injections of PGE1 are extremely damaging to penis, and the scar from injection site can only be partially healed. The injection industry is a multi-million-dollar business. I have not heard of much success from it. Number 4, if you are planning to visit a doctor for your Peyronie's condition, use a digital camera and take a picture of the fullest erection you can get. Bring the camera to him and show him many different angles to get an idea of the state of the Peyronie's condition. Doing this will allow you to avoid getting a shot to give you an erection for him to see curvature and/or damage. Again, do not allow anything to be injected into your penis. Injections will only further the damage. There is no benefit of any product on the market that involves sticking a needle into your penis. Injections to get erections will lead to severe, permanent damage to penis. Also, many patients' penises were further damaged when aggressive doctors pulled on the patient's penis to feel for scar tissue and lumps. Number 5, do not decide to get any type of surgery until after reading this book. Surgery is an absolute last resort. By no means am I educated of which surgery is best. From what I have gathered, if you must get surgery, your best bet is the implant. Again, do not take my advice when it comes to surgery. That choice would be entirely up to you if you so decide to get surgery, or if you have no other choice. Any cutting into the penis causes secondary scarring damage, which is irreversible. Number 6, if you are using the VED, vacuum erection device, do not use the constriction ring at all. Throw it away. This book will teach you how to restore your erection back. The VED can be used to bring blood to penis only in dire situations at a low pressure. Dr. Lynn talks about how to use VED after penis injuries only if the patient cannot get an erection without it. I never used the VED, and I'm not familiar with it, but I do know the constriction ring is a big no-no. I believe Dr. Lynn recommends only pumping about 50% of full erection for 10 minutes twice a day for healing. The exact instructions for this are on his website. Number 7, stop over-masturbating/over-sex and over-ejaculating. You will be allowed to ejaculate 1 to 3 times a week from now on in order to heal. Semen retention is crucial for healing power. Number 8, Stop forcing yourself to have sex or masturbate if you feel discomfort or pain. It is most likely doing more harm. Number 9. Stop using that crazy formula that involves castor oil along with other chemicals onto your penis. If you do not know what I am talking about, lucky you. Number 10. I would also advise you to second-guess any of these miracle drugs that you are using after you have finished reading this book. Please research and take into consideration the side effects of many of these drugs. Hopefully, after reading this book, you will realize that natural, gradual healing is the only way to heal. Look, the bottom line is this. Do not let yourself feel dumb if you have been using these formulas and devices to cure your impotence and/or Peyronies. Unfortunately, up until this site, there has not been any known real cure or even an intelligent explanation to help cure and explain Peyronies and/or impotence. It's not your fault. So please do not blame yourself if you have done further damage with the so-called cures.